Hi, my name is Shelley Swap. I am a clinical herbalist, and I get asked all the time, what is clinical herbalism and what is herbal healthcare? So let me see if I can answer those questions for you today. Today's herbal therapy combines the ancient practices of traditional Chinese medicine, Ayurvedic, and Native American herbalism with nutrition and modern research. So what does that mean to you? We live in an amazing day and age where heart attacks and strokes can be treated at the first signs and stopped in their tracks. Tumors can be removed from their body. Intricate surgeries can be utilized to repair all sorts of tears and injuries in the body, and many infections are stopped in their tracks by antibiotics and Western medication. But once those emergencies are abated and tumors are removed, infections are killed, and our bodies are put back together, we are often left depleted and exhausted, and getting back to normal can seem almost impossible. That's where the power of herbalism shines. Herbalism is based on the ancient records of thousands of years of observation and study of how herbs and minerals work to detoxify, nourish, rebuild, and restore the human body. Let me see if I can give you an example of how it works. So while I was studying in the Langhua Traditional Chinese Medicine Hospital in Shanghai, China, I saw an elderly man who had been brought in by his relatives. He was in desperate need of a pacemaker in order to survive, but the Western medicine hospitals had refused to perform the life-saving surgery because they were convinced that he was not strong enough to survive. Understandable. So his relatives brought him to the traditional Chinese medicine doctors and the Western medicine doctors who worked together at this hospital. And sure enough, by utilizing both herbal therapy and Western medicine protocols, 2 weeks later, this gentleman was cleared for the surgery. So it may be hard to get your head around the idea that ancient practices of herbal medicine can be the missing link in our modern healthcare model. But our ancestors were awesome. They were experts with natural resources, and they had a huge need to not only survive, but to thrive in order to be able to make it from one day to another. They had to utilize their powers of observation because they didn't have things like x-rays and blood tests, microscopes, strep tests in order to know what was going on. So they became masters of understanding and observation. And they not only observed the human body, but they were able to observe how plants, minerals, and animals that they utilized affected the human body. So as their understandings progressed, so did their ability to apply those herbs more directly to specific organ systems based on the patterns that they were observing. They learned to incorporate everything around them into their daily lives, as well as how to utilize them to combat all sorts of what they call patterns or imbalances. Today we recognize those imbalances and those patterns often as diseases, as viruses, as mineral deficiencies, and they were able to apply their knowledge to restore full function, or as full as function as possible, to the human body in order for them to survive, to really survive and thrive. Applying those same principles today is just as important. So, essential to my approach is the individual. 5 different people may come into my clinic complaining of exhaustion, and yet their underlying patterns can be completely different, which means that their herbal formulas, the nutritional recommendations, and the lifestyle recommendations that I'll make will likely be as unique as they are. The same thing goes for heart disease, depression, anxiety, digestion issues, sleep, and chronic, bladder infections, and on and on. I also pay close attention to the health of the corresponding organ systems. So you're not coming in for a symptom relief. You may think you are, but I am going to be looking really closely at all of the corresponding organ systems and how those are playing in to the complaint that you have that you're coming to see me for. Because when we can restore the body and restore all those underlying organ systems to fuller health and fuller function, not only do your symptoms disappear, but you have more energy and you have a longer, healthier life ahead of you. So if you're worried that you can't work with an herbalist because you are seeing other medical doctors, please put that worry aside. My clients' MDs are thrilled with the results they are getting, and they love that their patients are healthier, that they need less medication, and that they are taking an active role in their health care. Everything important is connected to our health. Everything is. And when we are dealing with unresolved health care issues, everything that's important to us gets put on the back burner. So I hope that you will, by taking the time to listen, be inspired to move forward, to schedule some time that we can sit together and talk. I invite you to request a free 15-minute session. You can do that on my Facebook page. You can do it right here on my website, or send me an email, and either I or my assistant will get back to you, and we'll see if we can schedule a time so that I can give you a better idea as to how I can work with your individual situation, with your individual concerns, and what it will look like. So until then, I hope you're well. Thank you for listening, and